Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Today we are going to discuss regarding factitious disorder. Factitious disorder is a condition in which a person acts as if he or she has an illness by deliberately producing, feigning or exaggerating symptoms. What are the etiological factors of factitious disorder? It can be classified under psychosocial factors like childhood abuse, deprivation, escape from a traumatic home situation, rejecting mother or an absent father. Sometimes the etiology is related to repetitional compulsion, and some of them are due to masochist personality. Some patients may attempt to master the past and the early trauma of serious medical illness or hospitalization. Some patients who have had a relative who was hospitalized with the illness they are simulating. And the biological factors, which include some researchers have proposed that the brain dysfunction may be a factor in factitious disorders. It has been hypothesized that impaired information processing contributes to the pseudologia fantastica and aberrant behavior in some patients. However, no genetic patterns have been established, and electroencephalographic studies noted no specific abnormalities in patients with factitious disorders. Factitious disorder has been divided into two groups. First one is marked by psychological symptoms and the another one is marked by physical symptoms. Both may occur together. DSM-5 does not distinguish between the two. It is divided into imposed on self and imposed on another. The clinical features include the symptoms like bereavement, depression, post-traumatic stress disorder, pain disorder, psychosis, hypersomnia, bipolar I disorder, eating disorder, amnesia, substance-related disorder, transsexualism, paraphilia, dissociative identity disorder, etc. The differential diagnosis, conversion disorder, especially hypochondriasis and personality disorders, etc. Comes to the management. There are three major goals in the treatment and management of factitious disorders, which are: first one, to reduce the risk of morbidity and mortality; second one, to address the underlying emotional needs or psychiatric diagnosis underlying factitious illness behavior; then the third one, to be mindful of legal and ethical issues. The guidelines for management and treatment of the factitious disorders. It include active pursuit of a prompt diagnosis can minimize the risk of morbidity and mortality. Minimize harm. Avoid unnecessary tests and procedures, especially if invasive. Treat according to the clinical judgment, keeping in mind that subjective complaints may be deceptive. Regular interdisciplinary meeting to reduce conflict and splitting among the staff. Manage staff counter transference also. Consider facilitating healing by using the double bind technique or face-saving behavioral strategies such as self-hypnosis or biofeedback. All about factitious disorder. So see you on next day. Have a nice day.